Same thing happened with the guy I saw, they never really made it too clear. He just said,
Carol, just let me know when you're ready to roll.
I am ready to go.
You are ready, Faith? Are you ready?
We are ready.
Okay, well, we will convene the meeting. Hello, everyone. Hope you had a good Thanksgiving and a holiday. We will jump right into our meeting. We're going to do a roll call real quick. If you would like to go through and do a quick roll call, how's that?
Yep, absolutely. So logging me virtually, we have Secretary DeMatteis and Michael Pagata. And here in person, we have the Lieutenant Governor, Representative Fallenbach, Commissioner Navarro, Michael, Representative Ramon, Wayne Emsley, David Craik, Jeff Tashner, and Bill Overly.
Okay, great. And we'll probably have some others coming along, as well, I would anticipate. So we appreciate that. I know Secretary Geisenberger and some of them, he had contacted me this morning with some of his feedback. I know there is a very important meeting with the Port of Wilmington that's occurring that he couldn't divide himself in two, so.
And I let Faith know, Denise Allen texted me before the meeting. Her daughter had a baby at 6 o'clock this morning. She was hoping to be here in person, but she said she'll be joining us virtually, but late.
Is she still in Germany?
No, she's back,
Okay,
but it was a
Her life is
grandchild that
not
arrived this morning, so they were still at the hospital.
okay, that's great. Well, congratulations to her. That's awesome. All right, so let us go ahead and take a quick review of our October 26th minutes. If we have any edits or changes from anyone on the 26th.
Move to accept.
Okay, got a motion. Do I have a second?
Second.
A second by Representative Bombach. All in favor, signal by saying aye.
Aye.
Any nays or abstentions? All right, hearing none, our minutes are approved from October 26th. Okay, moving right on to item number 3. I know that this has been an ongoing conversation among members about the healthcare pricing. And so if we want to go right there, I know Representative Bombach, you've worked with this with some of our other colleagues here. I don't know if you want to take a lead or have someone else.
So if you could look at the document, the one page begins consolidated recommendations motion. And I want to look at the second paragraph, something that Senator Townsend and Mr. Tashner and Representative Overly and I have worked on. And I do have a clause to propose being included. But the motion is, or at least a write-up of the proposal is in that paragraph. On the last line after Medicaid members, I have a proposal to add and collaborating with larger employers of Delaware residents. And the purpose of that is in the past when this was attempted, anecdotally, the cost of healthcare was shifted from employers of state employees to employers of non-state employees. So from the public to the private sector. So it brought the cost to the government down and it brought the cost to our private employers up within the state of Delaware, which was just sort of a whack-a-mole, which I don't think was the intention. So this is just suggesting that there be an inclusion of discussion with private employers also. Again, the phrase is to add after the Medicaid members, comma, and collaborating with larger employers of Delaware residents, comma, to require greater transparency, consistency, affordability, and sustainability. And I did not discuss that with anyone else here. I just want to throw that out there.
And you said with Medicare.
After the Medicaid members.
Medicaid members.
On the last,
Okay.
on the
Got
next
it.
to last
Okay.
line.
I wanted to make sure I heard the right line. And
Yep.
I want to make sure people heard the Medicaid versus Medicare. All right. So where do we start, gentlemen? Some of you have been, oh my gosh, what did you do with your hand?
Surgery.
Okay, at least it wasn't a cut, it wasn't something
No.
exciting. Okay.
Question for Paul. How extensive do you contemplate this collaboration?
You might have to
be?
speak up for people.
Oh, I'm sorry. How extensive do you anticipate this collaboration to be?
I don't have an answer for that. I think that if you, assuming this is put into a recommendation from the advisory subcommittee, it really is up to the legislature and the administration on how to take it forward. And it is a word, collaborating, that there's no adverb on it of substantial or minimal. So it's in the eye of the beholder and the eye of the implementer. Certainly it's the subcommittee's pleasure to add an adverb to indicate a degree there, or to leave it at this level of unpreciseness. Imprecision would be, I think, the better term.
Just a comment. I have always thought that if the state could control and lower pricing, that in effect would have an impact on the private sector as well.
So as I understood it, something like this was attempted in the early 2000s. I heard this from Secretary Geisenberger this morning. And that when that happened, an almost immediate opposite direction of the cost of the private employers happened. So unlike what our hope would be, is that if we address it in the public sector, the private sector sees their costs come down also. There is the concern of we don't want to do it in a way that has the opposite effect. So that's what the purpose is. And I will say from a sausage making perspective, there's also the concern that if we quote shut out the private sector from this, that can make it harder if there's a legislative piece to this, that it gathers sufficient votes to cross the finish line.
Go ahead, Jeff. And so that you're aware, our co-chair, Senator Townsend, has joined. He is off video, but he is present. Thank you, Senator Townsend.
And I think from my perspective, this is consistent with the problem we're trying to wrestle with, which is that prices in Delaware are too high. And the recent RAND study, which said that I think it was inpatient hospital costs were 280% roughly of the CMS rate, and outpatient hospital costs were 360% of CMS, applied to all spend in Delaware. It wasn't just the state plan. So I'm in support of it, Paul. I think the one thing that the providers shouldn't be allowed to do is, if prices are too high, we need to address that across the board. And they shouldn't say they're going to lower it here, but get it back there. That's rewarding them for bad behavior. And then I think what we need to do is correct that.
Thank you all for that conversation, having been in the legislature during that time. I think Representative Overdy, you might remember, Senator Peterson, I don't know, was representative at that time, Dave Ennis, and some others too, because we were addressing medical liability and a lot of issues. So good thing. Yes.
In the danger of wordsmithing this too much, should we add in the first sentence, as adopted by us in the 24th, advises that the General Assembly and Governor immediately effectively address the issue of healthcare pricing in Delaware for the public and private sector? Would that, we need to include it there as well?
So I don't think that would harm, but I think that given that we didn't limit it in that clause for the public sector, that I think it leaves it open to cover both of those. So I'd say it's not necessary, but if there's going to come a level.
I agree.
I think
Public is private. I mean, it's this, there's no difference.
It's the same. I agree with the insurance commissioner, just to keep as is.
One of the things that, I wasn't here for last meeting, so I apologize if I'm regurgitating what may have already been said, but the model that was followed in Maryland several years ago has had a profound impact on costs, the increase in costs over the years, and I think that's a good start.
And I've heard that also Indiana recently has, and they may have encountered something where they had their little seesaw on the prices, and they went back and looked at it. That's recently written up. I haven't read the article yet about it.
I haven't read it either, but I think that's accurate.
So, and I think we've got laboratories across the country that this effort, and we're encouraging, we'll be looking at to say, let's avoid the stuff that doesn't work, and let's try to do more of the stuff that does work and bring it here to Delaware.
So I know Jeff and Bill have been involved with this for years. Has the state ever undertaken this type of effort to this extent?
There have been efforts. I think Oregon, you can add to the list, and perhaps the state of Washington. I don't have all my notes here.
No, but I've had for us.
Oh, have we? No, not that I'm aware of. I mean, there may have been some governmental groups that have looked at the pricing issue, but not in a holistic way.
We
that I'm
had,
aware of.
we had the benchmarking effort that was maybe 4 years ago or so that was begun, but never got far enough to get the desired results. And it was one to have targets so that the annual increase would stay under a measured percentage amount. And we began by at least let's measure it and let's report it and let's compare it to our goal. But if there's a mismatch, there was no teeth to change anything there. So it's more of a viewing it as opposed to affecting it. I think that's fair.
I think that was under Dr. Walker's, Kara Walker, I think that was one of her initiatives those years ago. And it's one that we supported, we all talked about. The one thing I will say is, one of the things we struggle with is the contracts between the providers and insurers, which are private, which we don't get involved in, which we're not privy to. And that's one of the biggest challenges, because in some cases they're evergreen, meaning that they can't change it, the insurers. So it's a real problem that needs to be discussed.
And I think that this effort, as long as this effort includes people from the insurance commissioner's office and your network across the country to find out, so what did Indiana do? What did Oregon do? What did Maryland do? To find out, how they were able to pierce, that veil to the extent that was necessary to get it across the finish line.
So it was a collaborative effort, not just with the departments of insurance, because as you know, we don't regulate the providers, right?
Mhm.
So DHSS on our side, we need to work closely with them, just like they've done in other states. And other states are just different. So I don't know precisely how that marriage works, but I know how it could work here and how it needs to work here.
And one thing you may note is this paragraph is notably different than an earlier version where it was very prescriptive of task force with these members and all that sort of stuff. And it was through collaboration that this was arrived at. And it was let's leave it to these folks, including the leaders of the legislature, to figure out the right way to accomplish it.
So essentially, you're saying pull what we had already approved and replace it with this.
I don't think I'm not certain that we
We-
finalized it.
We haven't
tabled it.
finalized
You
it.
tabled
We
it.
tabled it. We did not
Early
finalize.
October.
And,
The idea was, rather than talking about the actual structure, let's make a strong statement of the intent and provide the direction, and then, like the insurance commissioner and others have said, figure out what the best mix is to really. And I think the most important words in this whole sentence to me are this whole area are immediately and effectively address. Because David, that's what's happened in the past.
Right.
This has been brought to light through a number of task force back in 2015, a number of people in front of the SEBC, the Hopkins group ran,
Mhm.
and every time we get started, it's gonna be a surprise, we run into roadblocks, and we know what they are, and that just means we all continue to pay prices that are just out of line.
So form will follow function. Again, or we went back to, and as the members, are you comfortable? I'm just gonna put Faith maybe on the spot, or Secretary DeMatteis, the SEBC research, and that's where you want it housed, not under, just making sure, under the subgroup rating, the SEBC, the entity.
We're not on that.
I'm jumping ahead.
Okay, so, and
I
I'm
jumped
fine
ahead.
because,
So you're keeping it under something more global, under.
well,
item
actually,
number
we're not in healthcare pricing
You're just
for
keeping it
item number
global.
3, we're leaving it general and we're not saying
General,
it
okay.
should be under
two. One or
HCC
the
or
other. I
anything
just wanted
else.
to make sure, for clarity purpose, it's on the record document.
Yes.
Okay.
Yeah. And you could say, well,
Because
I
any of the
guess
subgroup is
that's probably under
underneath that.
this
Yes,
item number 4.
yes, yeah.
Okay, so we're.
I'm moving you along.
And that's good, I like that. And I had a side question from Wayne, which is, do we need a motion for this? And what I'm picturing is, we're gonna address all that in 6, but I wanna make sure we talk about this in the depth that we're comfortable with, so that we can be considerate within the consolidated sort of omnibus motion for
Right.
item number 6.
Okay, and Senator Townsend, I don't know if you wanted to add anything. I know he's present with us. He could not be on video safely today. I know he was part of that. Go ahead, sir.
Thank you, Lieutenant Governor. No, nothing to add. I appreciate the frustration from Jeff and others over the years, Bill and others who've seen this talked about but not addressed. I appreciate the insurance commissioner and his team's efforts the past few years to work with some in the legislature to address this in, not, I think in the way, none of us, I think, have talked about in the way that we're now going to be talking about it coming off of this, but we've been trying to work on this, and it really is long past time to tackle it absolutely head on. So I appreciate the insurance commissioner's guidance and words on that, and Jeff and Bill and others' commitment to it. And I do think it is a key part of really tackling the root of what's happening here.
Thank you. And we appreciate, we know you have to be flexible today, so we understand, sir, if you're on and off, but we appreciate your feedback and contributions here today. Thanks. All right. Yes, Representative Overly.
So Paul, let me completely understand. I have been out of pocket for about a week, so your purpose in presenting this is to replace the very specific resolution that you and I introduced, correct?
That's correct, which is currently tabled.
Correct.
Yes.
Correct. But I want to get your sense around the lack of specificity. I mean, do you contemplate that we'll be looking at reference-based pricing, or whomever this group is, certificate of need, all the things that were articulated in that original resolution?
My expectation, I think there's a concern that we want to avoid being forced into a box that says, go through the deep study with all the details of what you're doing and create the report and essentially lose the momentum and again, not accomplish anything. We've got the studies, we've got the recommendations. We do know certain states have done things in the years since the last review, but we don't necessarily want to go through the task force not that was our intention certainly, but we don't want to be forced to go through a task force process to do what we know we need to do. Giving the legislature the flexibility and in the governor to identify the steps and go with that is the motivation for taking the task force approach, which would have, one of the things we're worried about is fiscal notes on if it's sitting under a certain department, doesn't have the staffing, needs more staffing, then we need to get in fiscal, then we need to get a House Appropriations Committee, then needs to get a JFC, and all these things that would be hurdles to pass before you can actually put pen to paper. And I think most people in the room feel that we know what we need to do, and we don't necessarily need to go through a 6-month task force process. And 6-month process to set up the task force is this 6-month process to have the task force give us the steps that we need to take when I think we already have that, most of that work done.
Representative Ramon.
I was trying to look at those notes because I can't see on here, but I didn't remember. I apologize.
As a follow-up, I'm
Yeah.
just kind of curious, I mean, what entity do you envision will carry out this task?
I think that we've got a possibility that we will. I think that we can end up with legislation to have the first, here's what the companies need to do. It starts as of July 1st of 2025 or 2026, but we can identify the steps in 2024 by June 30th with a law that says, here's the path that we are setting down, and here's the glide path to get to enactment and get to it being effective. And I don't see obviously I don't see a requirement that it goes through any specific additional administrative steps such as task force and recommendations.
Can I make you suggestions too, so that it's on record? It should be always on record. It's shared in our minutes and our notes. Certainly whether it's a supplement to the report or a supplement to a link, we're gonna have links in the report so that there could be reference back, right? Because I hear what you're saying, form follows function. I get what you're saying. You want that wiggle room, that flexibility, but I also recognize why you might say eliminate certificate of need, or I can understand where you got into some of those specifics. And I understand respectfully why he doesn't have that level here, because he's gonna allow the wiggle room that may be necessary. But I think there is kind of like that room for both camps, right? Because what you created had some really great components, and I'm sure all of us here I assume a lot of that's gonna be here and addressed.
I honestly just wanted to make sure that those specific issues are not going to be precluded from being looked at moving forward.
If I can defer to either Mr. Tashner or Senator Townsend, since they were the last ones to sort of finalize some wording on this, maybe you have some insight on best fielding
Yeah,
those
I
questions.
don't remember any conversation that would preclude or eliminate those things.
Right,
It was
because there's some
more-
good things in
It
there.
was more the vehicle for doing it, the
Right.
structure. And what I find encouraging from what I'm hearing the representatives say today is that we might actually get to the point of drafting and
Some
dealing with legislation rather than a committee to talk about doing that, which means we're actually going to be expediting this rather than delaying it.
Right.
But those things, reference-based pricing, what's been done in the other states, the global budget in Maryland, all that stuff should still be a part of this. None of our conversations said that those wouldn't be considered.
No, I just want to get on the record.
Get it on the record and have that, and we can still have that, your example, your example didn't go away, right? Your
Yeah, and I
specific motion
should be
still
clear,
exists.
it's not that I have mistrust in the process. I just was not party to the discussions with Representative Baumbeck and Senator Townsend. So I thought it was important to get that on.
Yep.
Okay.
I concur. I'll be the first to sign out on a certificate of need off record. For
Madam Chair.
years, yes,
Um,
Mr. Insurance Commissioner.
So the workers' comp fee schedule that was put into place before I started as well.
It was what?
I think that is a place that we could start and look at that legislation. Because it did everything it was supposed to do and more. 7 straight years of decreases in workers' comp insurance premiums,
Mhm.
which is music to the business industry's ears. But I think if we take a look at that legislation and perhaps suggest a fee schedule for health insurance outside of workers' comp, it's a great start.
Yes.
And it worked, and perhaps that's a way we can start this. To Bill's question about where it should be housed, great question. This is not insurance regulation. Just like the Office of Value-Based Healthcare was not insurance regulation, but we took it on. And we took it on without funding, and we took it on without expertise. And I will say that the Office of Value-Based Healthcare Delivery is doing wonderful things, but it's not something that falls within our jurisdiction and really our expertise. Having said that, we have people in place now who we hired through the process, and we'd be certainly happy to work in tandem with them. But it's not something that everyone thinks that because insurance rates are going through the roof, and they are, that this should be an the part of insurance initiative, and it really isn't. It really isn't, because we have no control over, we learned this over the providers and the costs in the hospitals and things like that.
I think one thing to point out is, with the exception of myself, we have 3 of the 4 caucuses and leadership from those 4 caucuses as subcommittee members. So we've got the House Minority Leader, here at the table. Through additional conversations, we realized task forces are sometimes needed to drum up legislative support. I think because of the people we have at the table, and because of the hard work of this subcommittee over this year, we suspected that we didn't need to throw in an intermediate, build the momentum, build the case, step in there.
You're exactly right. I mean, this goes back to 2015 when we had the joint task force. And one of the things was that pricing was too high. They talked there about bending the curve, and we kept saying, it's not just bending the curve, it's properly placing the curve and then bending it. So the case has been made. It's time to get to doing something about it.
And talking about getting something to do, it is 1:30, but who's monitoring time? And we have a lot of things to do. Sorry, perfect segue. Discussion on healthcare pricing. Are we gonna move on then? Is that what your goal was, to move
Yeah,
on to number
but-
4? Okay.
As long as there's no, oh my gosh, we have something to add or delete from that wording, we're generally good.
Right,
Okay,
right.
cool.
Representative, if I may, when we are ready to take motions and
We'll do
voting
public
on
comment.
recommendations, I would just ask that for the record, could you read back the motion
Yeah.
with those edits so that
Right.
we have. that
When you're
on
ready, and then we'll
Yes.
allow any public comment if we agree to do that.
That sounds good.
Thank you.
Okay, so let's keep moving.
So
It's been
for
a
the,
half hour.
so for the pre-65 retiree benefits, just as a review, remember, they receive the same choice of plans as current employees, and it's not that we're gonna be changing the plans. So what can we do? We can change premium share. And we can also, since we've learned that the premium, and I sort of put scare quotes around it, that is assessed for both employees and pre-65 retirees is not matched perfectly to the actual cost of providing that healthcare to that employee or to that pre-65 retiree, nor is it for the post-65 retiree. And as a matter of fact, it's the premium is undershoots what the cost of delivering that to the entire group, and to the extent of somewhere in the order of 30% or so. So one of the things, and for 65 plus retirees, the premium is above what the cost of delivering that service is to them. So what I've written up here, again, this is the third paragraph of the consolidated recommendation, is that we asked the SEBC research and measure the actual costs for those. Frankly, it'd be best to have three populations, subpopulations, and then also come up with a glide path to get there. Because the last thing we want to do is either, well, I think we're willing to lower someone's premiums in 1 year by 20 or 30%, but I think what we're really looking to do is do a glide path from where we are currently for each of these populations to something that is much closer to equitable with the cost delivering that service to that population. So that's what the intent of the third paragraph under subgroup rating, and this would have the impact of raising revenues and lowering the state share or the state cost for pre-65 retirees, and really, I was going to say is the main thing that we would do to lower the state cost for this population, which as a subgroup, as a subcommittee, we've not done much in the way of recommendations. But I would be immediately corrected by Jeff and Bill by saying, except for the darn healthcare pricing, because that would help everyone in the state. But anyway, subgroup pricing, item number 4 on the agenda, pre-65 is where we've seen a mismatch between what they're charged and what it costs the state to provide that service, and therefore this proposed part of the consolidated recommendation motion is intended to bring that forward to encourage an analysis and then a path to have the premium that's charged to that population be much closer to what the state's cost of that is.
And Paul, I think 5 also addresses that
Mhm.
population.
Yeah,
It does, because that would lower the premium. We've got the ABC at the end. So yeah, there's 2 elements for 5, but you're right, that this,
The coordination of
the
benefits.
subgroup affects both populations certainly, and actually it also applies to non-retirees.
Mhm.
I have a comment and a question. So I understand the 3 subgroups, but since the state has had health insurance, it's a group health insurance program where you're spreading the risk among the
Mhm.
groups. So you're kind of taking that away. But on the middle, on the 3rd line, the sentence says we further recommend so forth, but then it talks about for covered individual to the experienced total cost of healthcare for covered individual. We're not doing a second step. And now
Mhm.
some of the expenses, passing it back to the individual. I mean, why is individual?
What's the first thing is I was throwing these words out and I'm no expert on this. Do you have an improved term for that?
I would keep it at the subgroup level that you referenced in the.
Subgroup
I don't know if you
participant?
need this sentence
The
at
total
all.
cost of healthcare assessed per subgroup to the experienced total cost of healthcare per subgroup. Or total cost of healthcare assessed to the experienced total cost of healthcare at the subgroup level. So take out the per covered individual on both the 3rd and the 4th line.
And your understanding of healthcare, for the record, includes both all medical prescription and all care?
Everything that goes
or-
into the measurement of
Okay.
the premium.
Okay,
Yeah.
everything in the premium,
So-
okay, just so that
I love seeing
omnibus,
a nonverbal communication from Faith that I got that
we have to
correct,
make
yes.
sure it includes, just, for the record for people to understand.
So if it says tie the total cost of healthcare assessed to the experienced total cost of healthcare at a subgroup level. Just take those 3 words twice out. Okay, thank you, David. So we're still on item number 4.
Yes,
Any other adjustments or questions or comments on subgroup rating?
again, these will all be recommendations, advisory. Okay.
Paul,
Mhm.
which part, and forgive me since I'm a little bit,
And anybody
Trying to
online,
follow
please
along.
feel free to raise your hand or speak up.
where you comment on the retiree coordination of benefits?
Yeah,
Have we gotten
I
to that
was,
part yet?
yeah, no, we haven't, and I was thinking we actually should be also looking at the next 2 sections of the retiree healthcare premium state share and retiree coordination of benefits, so.
So we just did 1,
Subgroup
2,
rating.
and 3 and subgroup rating. So now we are moving on for those listening. And I see Director Kate has joined us as well.
Do we have hands up? Everybody?
And we have a hand up from
Brian
Brian
Stegall.
from Willis Towers Watson.
yes, Brian, go ahead.
Thank you. Hi, everybody. Just a couple of points of clarity because I don't know who it was that was speaking, but somebody just made a comment relative to call it a larger experience pool versus 3 separate experience pools. And it's a important distinction to make in whatever we do or whatever's recommended. Because if the groups are solely rated on their own experience, and you almost have to track historical surpluses and deficits to factor into future rate actions, almost like having 3 separate funds versus using one total experience pool and then separately rating solely based on demographic and plan design differences on an expected basis with sort of the aggregate surplus spread to the 3 groups. So there's a distinction that needs to be made in whatever's recommended.
Brian, if I may, do you feel that the way that this paragraph is worded, where it puts the I'll say burden onto the SEBC that that can be adequately addressed at the SEBC level? Or
Yeah,
do
I think
you
it
feel
can
it's that
be.
wording?
Yeah, Representative Bombeck, I think it can be addressed at the SEBC level, especially since these are, motions for adoption and things can be changed. So it's certainly something we can look at.
Great, thank you.
Thank you. So
There's another hand up.
the other hand is up from, who is up? I don't see anybody
Oh,
else.
okay, never
Nope, never mind. All right, so moving on
so
to retiree. Go ahead.
Right, exactly. So if I can do them in order, talking about the retiree healthcare premium state share. So this is a change of how many years it takes to reach the maximum state share. Currently, it's less than 15 years is 0%, 15 to 17 and a half is 50, 17 and a half to 20 is 75% max state share. And then 20 or more years, you get to the 95%. Yes, it's 100% if you've retired before 2012 or whatever the heck it was. This shifts it so the minimum number of years to get the max state share moves from 20 to 25, and then backfills the other numbers a little bit.
Right.
So this is a change. It's a change that will should save the state dollars, and because of the grandfathering that we've adopted in our recommendations, won't be seen for quite a while, but it is one that adds number of years. It also should help us in retaining employees.
And it addresses our correction officers, police officers, and others who may retire, which you have put in that clause in there. You have it there.
Oh, thank you. I didn't remember that I put it in there. I knew I meant to.
Yes, you did. I just have to highlight. I'm like the sounding highlighter here, okay?
Any, so, couple questions. So for the troopers,
Yeah.
is there a separate schedule for them?
It's a good question.
I mean, because you don't want somebody with 10 years.
And
getting
correct,
100%.
if you're gonna have law enforcement.
So,
Well, for my understanding is, Tom can correct me if I'm wrong, they get full state share at 20 years.
Yes, so we'd have to,
So you would have to address,
it's gonna have to be
It
included.
has to be a separate schedule.
It's
Yeah.
gonna have
So
to.
it would most
Maintain.
likely be untouched by this. Is it, and it says this change would not apply to state employees who require less than 25, which
Right.
means
Yeah,
the
you're
current
not gonna
schedule
separate
would be the
what you're
one
saying
used
now.
for them. This only applies to people who don't have
No,
that.
they have, I think they have a different schedule than even the current schedule.
Is that true?
I believe so, Tom, if I can defer.
Sure.
Yeah, I think Dave's right.
For the record, say who you are, because
Tom
we're
Bracken,
recording.
Executive Director of the Delaware State Troopers Association, and I believe David's correct. I don't have the exact breakdown with me. But, okay.
Yeah, so
And-
Joanne and I just had a little sidebar, so the current schedule would not change for them,
No.
and they won't apply to this, okay.
So they would be carved out.
Okay, so the other question I have is at 25 years or more, how come it's not 100%?
Because we're not providing 100% right now. We're providing 95%, and the retiree with 20+ years currently is,
But we're talking about state share.
yes.
So we're
So state
providing
share
100%
should be
of state
100%
share, but
state
there's
share.
an employee share, which is different.
I'm sorry, but try that again.
Well, maybe I, because I think I created the confusion when I said 100% state share. The 100% state share is 95.5.
It's 95.
For
So we could put a
current
clarifying
Medicare
statement here.
retirees,
Correct.
but this is, applies to everybody, so if you're under 65, you get 100% of the state share, you're getting, I'm gonna say $500 for individual coverage, but then you're gonna pay $100 on your own premium.
It's a 13%.
Yeah, so they're paying 13%, so I
So
think,
Joanna, is there a different way, or David, to put these numbers over here to
I
make
think
that
you just
clear?
put
Is there need to be
100%,
two, is there need to be two
25.
columns?
you're not talking about employee share,
Yeah,
here,
that's
you're talking about
Yeah,
state
I
share.
got
So
you.
it should be 100.
100%.
Yeah.
So-
Joanne? Yep.
Okay. So yeah,
Lot.
your second column could have been then the 100% 95.5 versus if you wanted to
I
get
don't
into
think you wanna
specifics.
get into that level of detail.
And then
Okay.
that gives you the ability to adjust premiums from the SEBC level without affecting percentages.
Okay, so what changes are there?
Just changing 95 to 100 on that last
Right.
figure.
And then the other one, I'm wondering,
David, was there anything else?
should it be who are eligible to retire rather than are required to retire?
Separate schedule.
No, in the language here says, in the parentheses,
Oh,
it
yeah.
says who are required to retire at 25 years or less than 25.
Isn't everyone
They're not
eligible to
required,
retire?
but they're eligible to.
Isn't everybody eligible to retire? with
So
less than
the
25
state
years of
trooper
service?
is not required to retire
They
at
could
20
continue.
years. They are required to
At
retire at
55,
age
right?
55. They're eligible to retire at 20 years. So I think the appropriate language here would be eligible to retire at 20 years.
Why wouldn't it be both?
What?
Why wouldn't you have both with a little slash?
Because we don't require them to retire at 20 years.
But it's not just.
But if we change it to eligible, then that applies to every state employee. No state employee.
So we need to, but
Teachers
then we
wouldn't be
need to
covered
figure
then.
out the right language. My point is that troopers not retired.
Do we have it, Joanna, already?
Well, my recommendation would be for those that are mandatory requirement, like a mandatory retirement requirement.
Those who
prior to
have a
obtaining
mandatory,
25
that's a way to
years.
do it, a mandatory
Mandatory.
requirement, those who have a
Require-
mandatory
for
For
requirement,
those who are subject to a mandatory,
mandatory
Retirement.
retirement, that's how you get away with it, that way you have your age and your date.
Yeah, that resolves my problem, because I was gonna ask for some clarity around that. Because I don't think it's anyone's intent to take anything away from troopers.
No.
Right.
So,
It's not.
yeah.
subject to a mandatory retirement requirement, is that correct? We have a third word that begins with R. Okay, gotcha.
Okay, moving on,
Anything else in
anybody
that
has questions
paragraph?
online?
Commissioner, were you the one who asked about the coordination of benefits?
Yeah, I
Yes.
was confused from number 4 to number 5, so I apologize for that.
No, no,
But just a suggestion where it says we advise the Department of Human Resources adopt a retiree coordination of benefits policy. And this is probably a DHR question, but I think we should consider adding staff to do that. It may just be a person.
I'm gonna say, to me, this, our recommendations, we're not an implementation. For instance, if this goes through the legislature, or, and I think most of these things will, naturally, we're gonna have the Controller General's office figure out fiscal note, including whether there's a need for staffing increase and what the cost of that is. So I don't think that level of detail is warranted at this consolidated recommendation level.
I don't necessarily disagree,
Mhm.
but that's always a roadblock later on. You know, how are we gonna pay for it? Do we need additional people? You're adding more meetings. We all attend plenty of meetings and have plenty of job tasks, but if you're adding something else, I think it should be maybe not necessarily in this language, but it's important because it's gonna be a barrier later on.
Do you feel that having it in the minutes that accompanies the passage of this motion is sufficient, or would you feel more comfortable if there's a, we recognize that this may require a staff increase for DHR?
Is DHR on the line now?
Is
Is Claire on the line?
Secretary
Yes,
DeMatteis.
I'm on.
Go ahead.
Just wanted to.
I'm
Do you need
on,
us
and
to
it would
repeat?
require.
Okay.
No, it would require an additional staff person to Representative Bombach. The sentence you just stated, I think would be helpful.
okay.
All right, we'll put that in.
So we recognize that this change is expected, may require DHR to add a staff member.
I would just say maybe this may result in additional costs of staff or personnel, whatever word you
And
use.
additional staffing costs
Maybe
for
not
DHR.
costs, maybe just additional staffing, stop, done, period.
Additional DHR staffing.
Mhm.
Okay, Madam Secretary, is that acceptable? We recognize that this change may result in additional DHR staffing.
Yes, thank you.
Very good.
But where are you putting it though?
At the end, add a sentence, we recognize that this change may result in additional DHR staffing.
Right, retired. Okay, so right after the period of service, right?
No, after the end of that section.
That's great. Yeah,
May I ask the subcommittee to consider as well, using the word resources, and I'm only asking that for consideration because at least with the spousal coordination of benefits policy, there is some technology built in administering that.
Staffing and
I
other
would-
resources.
I would envision we would have to do something similar for this COB policy.
so do you want to bounce off of limiting them to quote staffing and just say, we understand this will result in additional costs,
Yeah.
which we feel need to be supported. The reality is we just weren't doing things the right way before, so it isn't really additional costs, it's costs that we didn't spend before doing it incorrectly, now we're gonna do it correctly, so I would just say, to do it correctly, it's gonna be a little more expensive, just simplify it as additional costs that we're noting. Your issue is gonna say, it's gonna come down to the floor, there's gonna be a fiscal note, they're gonna make that the issue. We're gonna say, look, we knew there was gonna be a fiscal note, and we're saying there may be additional costs to do this. And that,
And Representative
part of the
Ramon, it's not that we were doing it. Not that we were doing it incorrectly.
no, I didn't mean it that way, I'm
It
sorry.
just
I did not mean to say incorrectly, I just meant differently, then this is gonna probably cost more, I get it, sorry, apologies.
Let me add one thing, by including both staffing and other resources, to me, I'm thinking staffing's ongoing and resources is the one time, and I like having both of them in there. Because if you have a one-time
But
coding.
why are
thing-
we limiting, just say additional costs?
Yeah.
If it's staffing, resourcing today, tomorrow, whatever, we
Right.
know this is gonna have a fiscal note.
Right.
Take it into consideration, we have to digest this. Done. I think,
Is that-
Trini, I don't wanna speak for you, but I think the thought is, we don't want this to go down to the floor and then say, oh, wait a minute, now there's a fiscal note,
Right.
they don't talk, yeah, we did talk about it,
Yeah,
it's
we did
worth
talk
it,
about
this, you know,
costs.
that needs to be digested, whatever the cost is.
Yep.
Why limit it to just staff or just technology,
Right,
and
you should say
what if it's
costs.
not just technology in one
Then
area?
how about if we just say additional DHR resources?
You could say
Is that okay?
resources. Resources or
Okay.
costs, coverage. Resources for.
Funds, whatever.
Yeah, I think
Funds.
DHR resources is the fewest words that gets it
Okay,
taken care of.
anyone else?
And-
Okay,
Thank you, Paul.
And
All
that
right.
brings us to ABC.
Okay, so up to this point, now I know Mr. Secretary Geisenberger is not here. He did have questions on some of these that I can try to be his mouth later. I won't do so now. Let you go ahead.
So, we have, and I've, I think, discussed the last two meetings, how we've not yet discussed, we just said, well, we're grandfathering, but we haven't said for 65 plus retirees who are not grandfathered, what changes? So this is intended to nail down what changes. And I think one thing that came across to me pretty clearly in the subcommittee is that we don't want to change the rules mid-game for our employees or for our retirees. So I have put a high priority on trying to get our subcommittee to say, for those hired after 2024, here is what you can count on. We can always make things better, but if that guideline that we're using now is used by future legislatures and governors, et cetera, we would the only changes we make for in the future for this non-grandfathered group would be improvements. So, but let's decide what is it that we are willing to accept of changes, which of course, one of our missions is to have the state get to covering the shortfall. And so, we wanted to grandfather to say that current retirees and current employees don't have to worry about changes. It means we're not saving money for them, but for the non-grandfathered folks, how much money are we willing to save for them? So we've got the table. I can't do anything without a nice table with numbers. And it presents A, B, and C, which is it provides the G and the L are two versions of Medigap currently. You can think of G as being generous and L as being less generous, if you want to do that. And I'll say the default one, which is C, is the 5% share between the state and the retiree. And what you see is that if you use those two columns with the 5%, you see the state is saving money on G of close to $250. That's because G is a little bit less generous than Medicare. It has an additional one-time Part B deductible or something like that in there. L is notably less expensive because it's less generous. That's what I'm saying the L is for. Saves the state more money, and it also saves the retiree some over G if they're in the healthiest 10%. And it costs a little bit more for the retiree. If they're in the 50th percentile, it costs them a whole bunch more if they're in the least healthy 10% group there. So that's the 5%. You can see that I have got this average of $448, which is what is that? I thought I knew what it was. I'm going to ignore this because I can't off the top of my head answer that. So let's ignore that right now. If you come over to the next column, actually go to the far right with the 9%, 0%. Here we're saying L saves the state a whole bunch because it's less generous and it covers less, and the premium that would be charged, the overall premium that would be charged to everyone who's paying the premium is much less. So we don't need money from the retiree, so we can have it 0%. But let's say we raise the premium share by the retiree to 9% there. You've got the state saving between $450 and $700 per retiree. This is non-grandfathered, of course. Those who are hired after 2024. So you have you're saving twice as much for those, or darn close to it, twice as much for those who choose G as in that first choice, because you're going from a 5% to a 9% share. But then you're also lowering for L, and you can see that L is actually going to save the retiree off of Medicare compared to Medicare if they're in the healthiest 10%. And if they're average, they're going to be seeing an increase that is less than anything that's offered at the 5% level. But again, they pay more for L if they're in the least healthy 10%. And it has G, which is more expensive for them than certainly a 5%, going from 5 to 9%. And then, of course, we need that Goldilocks just right. And that's my editorial approach, which is saying, what if we do a 7%, 0%? That's that middle column, and that's that choice B. And what I've been coming to the subcommittee for several meetings is to say, what is the pleasure of the subcommittee? What is the level of cost share, cost shift? Because a lot of this is shifting from the state to the retiree, the non-grandfathered future retirees 25+ years out. I'm sorry, 25 years. And this is actually Medicare age also, so it's 25 years plus however long between retirement and the time they reach 65.
Mhm.
So I'm happy to address this first.
Why don't you go first, and you might cover some of.
Well, and at the last meeting, I said things work better when everybody meets in the middle and there's give and take. And in our conversations between then and now, we've been pretty clear that, you know, we were willing to give in some of the other areas, the delaying of the acquisition of the state share, but we want to stay at 95.5. And there's a couple of reasons. Number one, we're moving away from Medic Fill into Medigap. And as Paul pointed out, even at 95.5, there's savings. So just for the sake of conversation, if everybody would go to G on a 30,000 person population, the state would save $7.125 million. If everybody would go to L based on the 30,000 people population, once you migrate everybody, it's 27.61 million. So it's going to be somewhere in between there. We know that the mere move from Medic Fill to the Medigap GRL is going to save money. And we're willing to do that. What we're not willing to do is compound that by saying we're going to save money and then we're going to shift more cost onto the plan member, the retiree, especially because at this point, we don't know what the outcome of the pricing work is going to be. And we think it's important to, at this point, let's save the money we're going to save. Let's do the pricing work. Let's do the coordination of benefits. Let's do the subgrouping before we're shifting more costs, just for the sake of shifting costs onto the retiree. So speaking for myself, and I think for Billy and for Mike Bagato, to us, this is a critical piece of it. We support C. And I can tell you, for me, if it's not C, even though I agree with everything else, I'm voting against this motion. Because that for us was pretty clearly a non-negotiable. I think your words were non-negotiable, correct?
This is for people not hired yet.
Correct.
People who have not been hired.
Right. I mean, we're going to recognize savings. We're going to do all this other stuff.
So I'm not suggesting I don't agree.
Okay.
But had we done this, what we're trying to do now, 20 years ago, we'd be in much better shape today, right?
Mhm.
So we have to consider 20 years out, right? The $7 million, that's not a lot of money. But 20 years from now, it's a de minimis savings potentially. So I think that we really have to look at, and I understand hiring and retaining people and everything else. I get that. I've lived that. But I think we really need to consider that. I heard your point. I just think that if we had done this years ago, we'd be in much better shape, and we have to think about the future.
Well, and one thing we did do years ago is that 5%. We did that back in 2011. And we haven't migrated the entire retiree population into that. In fact, I think most of the retirees are still not paying the 5%, correct?
Correct.
So I mean, there's still savings out there that are in the pipeline. We've done things, but it takes time for them to come to fruition. What I really worry about, especially knowing that we're talking about retirees, we're talking about people who are on a fixed income, and now just for the sake of doing it, we're going to put more cost on their shoulders. And we're not going to know what the outcome of the subgroup rating is. We're not going to know what benefits we get by dealing with pricing. We're not going to know if we save anything by coordination of the retiree benefits. And to me, I just think I can't justify simply putting more cost on them for the sake of doing it. I'm not saying down the road that us or people in these seats may have to do that at some point based upon this other work that gets done. I just think right now it's too early to do that. Let's let all the work play out and see where we are. Because here's what I do know. I don't know a lot of things, but I do know one thing. If we move off 95.5 now, say we go to 93.7, and all this other stuff produces savings, 10 years from now, no one's gonna say, you know what? Let's take it back to 95.5. Once the seal's off, the seal's off.
Right.
And that's what I don't want to do. We don't want to do to retirees who are gonna have to deal with this down the road.
So I cannot comment on what happened 20 years ago. But what I can say with certainty, last year, for the current population, the current employees, we voted on a 9.3. We're woefully short of where we needed to be. I'm not passing blame on anyone, but we're closer to high teens now, right? What we're potentially going to need. So I can only go back a year, but we were way off. And there was discussion in one of these meetings, SEBC meeting, about maybe making it a little bit higher. And no one wanted to talk about it. And I understand why, because no one wants to pay more. But look where we're at today compared to where we thought we would be just 1 year ago.
And take it one step further, because we've sat through many SEBC meetings. Over the years, there's been a lot of talk about smaller, more regular increases rather than waiting until we get to the cliff. For a variety of reasons, some good, some not so good. The cliff approach is the one we've embraced.
Yeah.
But I mean, I know when I was still on the SEBC and we were talking about this, I had them go back and run some of those numbers. Like, if the last 5 years, when we have not been increasing at all, we had been doing 1 or 2% and people could manage that, where would we be today? And we'd be in a tremendously better shape than that. But that's always, that's always been that tension.
Well, we couldn't do it in good conscience when we had a surplus.
Yeah.
Right? It's really hard to ask
Right.
our coworkers to pay more when there's no money left in the tank.
Yep. But I mean, you
We
look
could-
back
we could
now and
rewind.
say, if we had done that,
Yeah.
how much better off, will we be? And look, there are gonna be people who say, that's right, because you're building and I can manage. And other people are gonna say, no, take the cliff approach. People are gonna be on both sides of it.
And go ahead, David.
So my comments are kind of in between here, but we have done nothing to solve any immediate financial problems that are coming down the road.
That's why we need the funding recommendation.
Yeah. So, and this is so far down the road. I mean, it's for new hires, and then when they hit Medicare, to me, it doesn't matter what numbers we throw out here, because what's gonna drive this is the cost in the budget. This isn't gonna be a budget number. They're gonna say, we can't support 95 or 91 or whatever the number is. And somebody's gonna have to change it in the future. So I don't think it really matters. I'm gonna support Jeff's comments on the 5, but this is gonna come up again a lot sooner than what we think.
But when they make that decision, they're gonna have the benefit of some of this other work, which we don't have
Yes.
here today.
Yes.
And that to me is one of the critical
And
factors.
that's why I'm really willing to stay with 5, because a lot of things are gonna happen.
I don't know if Secretary DeMatteis is here. I don't know if she had spoken to Secretary Geisenberger. When he had called me, he was fine with 1, 2, 3, 4. When it came to A, B, and C, his biggest thing was, not only some of the numbers, but the fact we can't forecast the future. Will Medicare G and L and others be present? So I'm just putting that on the record. I promised the secretary I would share that comment. So he had reservation on these 3 items, A, B, and C. I don't think he would be here supportive if he were in person. And Madam Secretary.
Right, and his other,
to that.
yeah, Madam Chair, his other point is, let's be realistic. What we're talking about is somebody who would retire in the year 2072. So if we feel like we're doing something to impact the immediate problem, let's be realistic.
Right, and again, thank you, just passing on his words as asked. Representative Ramon?
And I kind of actually agree. I just have a lot of hesitation to put any numbers in. Why are we, here's the issue I think we're dealing with today. I think it was very clear for the last 20, 30 years, whatever. There was a commitment made by our state to people that this is your pay and this is your retirement and here's your package. And we're going to stick to that. And I feel honoring those obligations were important, and we've done amazing work here to be able to get to that path. I feel at this point, we have an obligation to new employees, to them to understand this is your pay And this is the formula by which we figure retirements when you retire. Rather than locking in on mathematical numbers that we have no idea, why are we here? We're here because we've been negative cash flowing a monstrous portion of what should be a balanced budget that hasn't been. So now we're developing a way to, and I'm not critiquing, I'm just saying that's the reality. This has been a bleed that we haven't digested for a multitude of reasons. And this effort is trying to get that in the mix. So like you said, we haven't really solved the problem. Maybe we will with, the next whatever commitment we make or whatever we do, but an employee's decision to work for the state should be made on accurate information. And if that accurate information is this is your pay, and over the next 25 years, this is the metrics. If we're bleeding, you're going to have a bigger piece. If we're not bleeding, you're going to have a smaller piece, or some sort of a formula. I just get very hesitant of locking in on numbers that aren't going to be accurate. That's not fair to them. And if we do lock in on them, well, then we sure as hell better honor them in 2070, whatever the heck we're talking about. Just my opinion. If I'm out of line, that's fine, but I'm just thinking it's difficult this way.
Right, Representative Bombach?
Yeah, and I want to thank everyone for, this is exactly what I'm looking for, is this kind of discussion and figuring out where we have consensus. My lean towards B is based on our earlier decision that we're not changing things for a 65-year-old retiree who is 25 today. We've got a 40-year impact before we can change that, or we can change this for the, I'll say, for the worse for the retiree. If we had a shorter one, then I'd say, sure, let's keep it flexible. But I don't want legislators 20 years from now saying, why the heck didn't that RHBAS set it to 7 and 0? We got to wait another 40 years before we can make that change, because we've sort of locked ourselves into this 40 year before we can impact this. I'd rather go harsher. And I get the, when's the last time the legislature made things, they took the surplus rather than redirecting it someplace. I get that completely. But because we've adopted this, we're not changing anything for new hires, and we're talking about 65 plus, we're talking about 40 year out there, as the secretary pointed out. I would rather not do the 5 and 5, which is to me the least change, and completely agree with Jeff that, and with Bill and with everyone from labor, where the agreement, for instance, of going from 20 to 25 was with the understanding that it was going to be 5 and 5. And that was, there was communication failure on my part there, but they were completely consistent on their side on that. Agreed, and I completely get Jeff and Bill's and Mike's views on that. But because that long window, and not that the legislature and the governor are necessarily going to agree to that, but because of what our subcommittee has adopted of not changing things for current and almost current employees, and this being a 65 plus impact, I'm uncomfortable not going further than the 5 and 5, because that long window before we're ever going to change things for them again.
But why do we have to lock in on a number as opposed to a formula? Well, I mean, or maybe
The
even
number is the result of a formula.
Currently, that's what we have.
I know we currently have, and that's why we're here today, because it wasn't.
Well, no, I don't
the
think
math wasn't
that's-
working.
That's not why we're here.
Well, I mean, that's one of the reasons. The effects of it might be one of the reasons. I mean, but to be honest, is there, just teach me why, because why wouldn't we? Well, maybe healthcare is gonna come way down because of the AI. I don't know, maybe whatever. What I'm saying is, there's so many variables to lock this in. I guess all I'm hesitant is that we're gonna hire people in the state of Delaware with a perceived portion of their package that should stay consistent for the next whatever amount of years so they can benefit from that. If we modify it in 5, well, then those 5 get this, then the next 5 get that, and it gets crazy. All I'm suggesting is that there was some sort of a formula based, their decision to take the job and to get their pay will be based on accurate information that won't be reneged on or not upheld. I don't know what that formula looks like, and I don't know that it's not beneficial to employees or it's more beneficial. I just don't know. But you're talking about 20-something years. Let's just go back 20 years and look at the difference in technology and costs and all. Medical cover or medical costs have gone up exorbitantly. Well, now with the new drugs and this AI stuff and whatever, maybe they come down just as quickly. And then you're not fair. I mean, then that number's not fair. And maybe yours isn't even fair at that point. But I'm just saying, locking in on the unknown 20 years out is, I think, just gives me a lot of angst. I would rather find some other way to face this flexibility.
And that's, look, you've identified the problem that we've had with this population forever, is we're being asked to put together a puzzle and there's no picture on the box.
Right.
Because we don't know what it's gonna be like down the road. We knew one thing, which was that we were gonna move away from medic fill, and we were gonna try to provide through the Medigap coverages, the best coverage we could that's equivalent. And currently, that's G. G may not exist in 20 years. We've kind of laid a marker out there for people who come after us, that whatever it is, it could be Medigap, L, Z by then, right? But they're gonna look at it and say, what's the best? That's what the intent was. As far as the split, we had up until 2011, it was simple because it was still, you got 100% covered by the state. And again, I want to make sure that people remember, for this population, we're not talking about the entire cost of healthcare. We are talking about the 20% that Medicare doesn't cover,
Right.
which is different than the other two populations for whom we are paying 100% of their health, or we're addressing 100% through the state contribution and their contribution. And this is the group that is, they're further along in life. Economics are an issue. We made a decision in 2011, 2012, because some people wanted skin in the game to start charging them at that point 5%. And that whole population still hasn't moved to the point where everybody that's Medicare eligible is paying the state 5%. In fact, most people are still
not
getting the
there.
100%. I can't justify at this point, because of all the unknowns that we've talked about the work we're yet to do. How can we say we want to move to 7 or 10 or 15 or 30? That's why I'm suggesting keep it at the status quo, which is the 95.5. Put everything else in motion, and then when the work starts getting done and we're starting to realize things, we'll be in a better position to make an informed decision about this population and whether to continue at the 95.5 or go to 93.7 or whatever. But some of, the buy up to GNL too also scares me, because this is some people are gonna say, well, L's cheaper, so I'll go there. But if you're not in good health, L may be cheaper from what you're paying for it, but you're gonna pay more for your health care. And I hate to push people in that direction. I just think in this area, status quo is where we should stay until we get more work done. So that's why.
My only simple question is, why do we have to say status quo? Why can't we say, this is where we've been, depending on where the market, the skin in the game concept, I know we talked about this for 10 years ago, whatever it was,
Because
maybe more. The skin in the game concept, I do have some validity in, even, I do believe people, even if it's only a little bit. I watch my father, he's much more frugal in his decisions, because even that little bit is a lot for him, right? So, and I do think it made a big difference and it helped. I do understand that a lot of people haven't even gotten to that yet. I get all that. All I'm suggesting is, if people are looking at, and they have an expectation of a pay and a benefit, and we all know that benefit's going to be modified, why are we locking in a number to say that, you could say it could be blah, 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 and here's your other options of what you can do, and time tells, but do you have to lock in on that number, I guess?
Michael, what would you say? Yet to be determined?
Or maybe something like not worse than, or not better than, or, just put parameters, not necessarily.
Because by January 1st of 2025, we have to have something. Because people are gonna be starting to be hired by the state and following what you're saying. We have to tell them at that
And
time what
gentlemen,
the
if I can move
expectation.
you in, Mr. David's had his hand up, he's so
Oh,
nice and
sorry.
quiet, he follows the
So,
rules of
I
the.
think we're not
Go ahead,
locking in a
David.
number, we're locking in a percentage. So
Right.
as the premiums go up, it goes up, if it goes down.
It's
it goes
relative.
down.
Okay, it is
So-
relative.
And you
Right.
could say a
And-
baseline, a minimum, you know, you could put that, go ahead.
All right.
Mr.
Well, are you done? Dave?
Yeah.
Okay, go ahead.
Am I correct in remembering that the 95.5, those rates are set by their legislative?
Yeah, correct. Well, all of this would have to be through code.
Okay, so I have to say, I support Representative Baumbach's notion of the 93.7 with the idea that that's, we're putting that out as sort of the worst case at the moment. And if you want to just word it as at a maximum of 93.7, whatever term is needed, I think we have our obligation to tell the legislature, to recommend to the legislature something. And I like the idea of, this is the worst case that we're suggesting. If you can make it better, legislature, make it, let it stay at 95.5. But we're saying at worst, go 93.7.
Represent remote, now you can.
Using that theory and my hesitation of locking in, could we say a range of blah to blah, depending on? Just
We could
give a
say whatever
range.
number you want, because
Yeah, you don't-
ultimately it's.
But it's 20 years away. Do we have to lock a number, or can we say a range based on?
Or a
Well,
minimum.
it's not 20
of-
years away because this is gonna apply
Effect
to
to
people
somebody
who
in
are
2 years from
hired
Well, no, I get that
on
part.
1/1,
I get that.
25, so we
A
need to,
minimum.
you need to be able to
Yeah,
say
minimum
something to
of
them.
blah with a maximum of blah. This is the range. And they make a decision based on that range. Now, if we have to compensate more, give them more money because we're modifying the range, then we have to consider that when we hire people. Pay them more money, but give us the flexibility of a range. I'm just thinking out loud, that's all.
Representative
And
Everly?
the struggle I have there is what criteria are gonna be applied to decide if we're at low blah or high blah, just to pick on it.
Yeah,
Because
For those
to me, if
listening
it's up to
on.
whim, that's the problem. I mean,
Hope you can follow
there's so
us.
much other work that needs
We're
to be
trying.
done before we make that decision. And I beat a dead horse.
but
I can
no,
just tell
no,
you
that's
that,
not beating a dead horse. That's the exact topic I'm trying to get to. You can't just blah to blah. You have to have triggers. If this, then that. If this, if we're in a whatever, then you go to this trigger or this trigger, and you have ways that it will fall into that range. But you can't just say, oh, the wind's blowing this way, we're gonna pick the high side or the low side because we want more money to spend in the
no
budget.
one's saying that. We're saying is keep it at 95.5 now, let the work get done, and then let people revisit it when they have the benefit of the work being done.
So these people who we hired today for 5 years, in 40 years or whatever, they may not get what we're promising them again. We're gonna go through this again.
Not saying that, I'm saying that this group is recommending a variety of things to be done. Let that work be done, and then let the decision makers, when that work's done, revisit this. And Michael, that may be before 1/1/25. I don't know how long it's gonna take.
Alright.
I can tell you that we struggle with just making the decision to shift costs to the retirees because we feel we need to do something and we're just gonna make retirees pay more. Right? When all this other work is done, we may not have to do that, and we're not gonna roll that back. So why don't we do the work, find out what it tells us, and then make an informed decision as to, hey, we don't have to do this, or yeah, we have to do this. And I think for the retiree population, if the work's done and it shows that you need to do it, everything I've heard from them, they'll be more willing, they won't be happy, but they'll understand why. But if you just say today, we're just gonna shift more cost to them, if I were a retiree, I'd be angry.
But these aren't retirees. These are people who haven't even taken a job
But
yet.
this
So
is,
they're-
this is the whole trust thing.
Okay, I got it.
Okay, you two, I love it.
I
I
got
love the
it.
dialogue. Representative
I got
Overly's
it.
hand's been up, then Representative Bombach. Representative Overly?
Well, let me just state my position. I mean, I have made this clear at the SEBC subcommittee level too. Until we tackle the pricing issue, I am unwilling to vote for anything that cost shifts more costs onto the backs of retirees or state employees. Now, I think we're taking a giant step forward on the cost side, the price side of the equation. And Trini, to your earlier comments, 15 years ago, if we had focused on the price side of the equation, we might even be in this room today talking about all these issues. So I agreed to support the eligibility, the changes in the eligibility, with the understanding that there would be no cost share shift onto the backs of retirees. So I am married to the 95 fund, and I'm right where Jeff is. If this committee, and they certainly have the right to do so, decides to go elsewhere, then I'm not going to support the package.
Now, having.
And I,
Yeah.
that's not a threat. I mean, I've been very clear.
Right.
With the co-chair on that.
Right.
From the
Right.
outset.
Right, and having said that, I mean, keep in mind, we are advisory to the legislature, to the governor, and it's been the three prongs. And this is an area that for years, under the eligibility, right, pre-Medicare has been a hot topic. We're having healthy conversation, and our goal is to package something that's very useful and a utility that doesn't sit on a shelf, that legislators address and do things with in the administration. And so I'm hearing some wiggle room here for potential compromise around pre-Medicare eligibility. We've got the other prong, right, which is our design plan. We've addressed that already, and we've got some great recommendations that are in the end of the report, which we will get to. I know poor Kristen is probably dying in her seat about the report at the end, where we're going to be looking at funding, right? Those are the three prongs of the stool, and we made great progress. So I, turn to you, Representative, too, if you feel strongly about some of these things with pre-Medicare. I mean, it's up to you. We can always call for a vote, but I certainly would like to be able to put forth a package where everyone is supportive of the whole totality.
So,
Yeah.
I'm really intrigued about the range of 5 to 7. I'm fixated on, we've said we're not changing anything for any current employee. So because we're talking 65 plus, we're talking about probably a 40-year delay between what we do and the impact. And, we didn't delay on funding from the budget based on the results from the pricing study. Okay, we acted on that, and we plan to act in the OEP now, not waiting for that result. I think that if I was a new employee starting in 2025, 2026, saying I'm going to have to pay 40 years from now between 5 and 7%, I think my eyes are open when I make that decision, which is, I think, what we're responsible for. And I am most comfortable with that. I'm fine with a 5 to 7% range in there. And if we want to have a sentence saying that if we find that our healthcare pricing reduction effort has brought costs down compared to 5 years earlier, whatever, some savings and even a metric of a 10% or more reduction there, then we will change it to 5%. I'm fine with that, but I don't want 5 or 10 years from now, a body like this to come together and say, we need to go to 7.0, and man, I wish we had done it in 2024. But we tied our hands, and this is not gonna have an impact for 40 years because they didn't do the savings on this side also. I agree with so much of what Jeff has said. And as far as this is a percent of the last 20%, because the Medicare age population is insured very differently. I get that completely. But I don't think that it is, to me, not unreasonable at all for a 40 years from now, a 65-plus-year-old retiree has to pay 7% instead of 5% of the cost, and that is something I think the legislature and the taxpayers are going to feel pleased with what we do today if we do that, and saying 5 to 7 so that we are clear to our new hires of what our promise is and that we will deliver on that promise.
And for the record, sorry that this discussion's gone on as long as it has, but I agree with you. I just think that we have an obligation to think about the future, and we fell short years ago thinking about our future, and future will repeat itself. And these cost measures that we've put in place within the SEBC that Willis Towers Watson's been recommending for years, just put a teeny tiny dent. In fact, maybe not even a measure. So just learn from our past, that's all. Having said that, I agree.
So let me clarify some comments here. So when we made these changes in 2011, they weren't wrong. They weren't late, and we did it based on retirement date. So they took effect the next year, not 40 years down the road. So I don't care what 5 to 9 or whatever, somebody's gonna be looking at this 10 years and say, well, why did they make it hired after 1/1/25 and not retired after 1/1/25? That's gonna be what they're gonna look at us, why did you do it like that, not the number.
So, you all capture what David just said? Go ahead,
Can I ask you a
Representative Ramon.
question?
Yeah.
Would, you said the 5 to 7, and I know the logic, and I actually have a little bit of angst about that we've gotten this far in certain levels of compromise and, working together have been digested on a perception that this part was already sort of agreed upon, and that troubles me also. I don't know if that's fair or not, but if you're saying 5 to 7, right? What if it was even it could be lower, what if it could be 3, 5, or 7, and once again, the decision is based on some kind of a metrics. Could you live with that?
My only concern.
Or just
is
say
if we
between
said,
3 and 7?
if we say no more than 7%.
No more than 7, no less than 3.
I think if we say 0, I think that a 22-year-old new hire may say, oh, it might be 0, and fixates on the 0 and didn't.
No, I didn't say
keep reading.
0, I'm saying 3 to 7.
3 to 7.
So there's always skin in the game. It just, this way it puts them in a little better possible situation. And I'm just thinking, trying to find this verbiage that works 20 years from now.
Right.
Yep.
So or that, or a baseline, what were you thinking?
I was thinking where I had hard percentages.
Yeah.
I would say between, what I'd done before your comment was between 5/95 and 7/93 for the first for G, and between 5/95 and 0/100 for L. That was before your comment, Representative Ramon. And that does not include a trigger statement saying that it would be our recommendation that there be a lower end to the extent that there is success in the healthcare pricing efforts.
So how does this play out legislatively? We currently have a statute that says 95.5 if you were after
Retired after 1 month.
Yeah.
How do you write a statute that says no more than this, no less than that?
Yeah, I don't think-
I mean,
You've got to make it clear with what is
The legislature's
determining
gonna
where
pick
you
a
are with
number.
that.
It's, yeah,
You'd have to make it very clear based on the pays, based on something,
and that's why,
cost of living, CPI increase, whatever. You just find, there's a way to do everything. You just gotta work on it and look into the math. You gotta find a consistent trigger that would enable you to digest. You have a prioritized motivation here, and I agree with it 100%. We've got to do something to motivate people to work on costs of care. I get it, you're right. We're in a situation right now where we're seeing things in different states. It's just stunning compared to my disappointment with what I'm seeing in my own state. It's hitting me right between the eyes because it's very prevalent for me right now. So I get that. So what I'm trying to say is this motivates everybody to work on that because everybody shares in that 3 to 7. It's not going to just be push the thing down the street type of thing. So I'm just trying to find a way to be considerate of the concerns of what you're saying, motivate people to focus on cost of care reductions and have something very defined that when I take a job here, if you're going to tell me it's 3, it better be 3. If you're going to tell me it's 5, it better be 5. If you're going to tell me it's 7, it better be 7. I'd rather you tell me it's 7 and it's going to be 7 than you tell me it's 3 and it's not. That's not fair. So, but if we give them a range, they know in 20 years, it won't be worse than this and it won't be better than that. I can take that. Then it's their decision and we have the flexibility within those parameters. Then we put on Kristen to find out how you get to the mathematical formula or something.
now, don't know, Senator Townsend, we elevated you to a different phone. I don't know if you wanted to say anything now or not. You do not have to, sir. Yes, sir.
Thank you, Lieutenant Governor. This is a pretty surreal conversation, given that weeks ago we touched on a topic that I didn't think we should have touched on, and now we're kind of, having to see how that plays out. So I appreciate people's dedication to this topic. It's kind of hard to wrap your mind around decades and decades away,
Right.
At least it is for me. And I look forward to, I don't dismiss at all, this issue. And I appreciate those who've continued to make the point that there needs to be. I think Jeff basically has said everything fantastically today. They shouldn't come at the expense of making sure to tackle the pricing issue and full stop. So that's all I have to say about it. Thank you, Lieutenant Governor.
Thank you, Senator. Co-chair. Anyway, so we have spent a lot of time. It is 2:30. I know that there was a will to try to get full consensus. I know you had consensus on items 1, 2, 3, and 4, down to the beginning of coordination of benefits.
But I
And
think 4, in
yeah.
fairness,
Yeah.
4 is contingent
Right.
on what happens on the last 3.
Right.
Maybe 6.
Right,
Is that
on the
fair?
last, yeah.
Yes.
It does, it's contingent. And we also promised any members of the public after we got to this point an opportunity to speak. And then we'll be able to get to the report, okay?
So
So,
are you saying the state share percentage is contingent on?
The 25-year eligibility range, that changed from 20 to 25 years. At least as far as 3 of the subcommittee members.
Yes.
Their comfort with that change is contingent on staying at 595 is what was stated.
Yeah.
by
So they're
Jeff.
not
But it is
tied
a-
together,
but they're not tied together, no.
For us, they are.
For them, they are, but not for you.
No, I understand.
Yep, not for you, and that's it. So my question would be, because again, I think we've made some great progress, and looking at Kristen, who wants to get to the report. Shall we,
I'd be-
defer to you?
I would be open
Mhm.
to seeing if we can get a majority vote for the 5 to 7% and 0 to 5% for L.
For a range?
Try that and we can go from there to a straight 595 for both as a second motion and see if we've got the votes for one or the other. That will inform us as to what we put into a consolidated motion for later discussion. If subcommittee members would prefer to defer that vote until after public comment, I think that's completely appropriate also, and
I mean,
also it's your call.
Yeah, no, I mean, I think that we're at a point, I would like to hear public comment always myself.
Okay.
Can I
Personally,
make a
yes,
motion
yeah.
that we go through 1, 2, and 3 and get them digested? I don't think any of those are relevant to 4, right?
I think
And
the,
then, go ahead, I'm sorry.
I think some of them were dependent on what we
Oh.
did below.
You mean what, well, no, 1, 2, and 3,
We're not
the
you.
OPEB funding, the healthcare pricing, the subgroup rating, those are your
Okay.
definition of 1, 2, and 3.
Yes, I'm
I
sorry.
think
Yeah.
we believe we already have consensus on that.
Oh, so we
And
have
we
a
are-
motion.
But we would need
We have
to.
your public comment.
I would like to have.
Wait,
public
no,
comment.
yes, so I was not proposing we vote on those before public comment. I was
Oh, I
only
understand.
wondering whether we wanted to see amongst us if there's, but I think it's a great idea to go to public
Yeah.
comment at this time.
Now, I would do public comment. Okay, so do we have anybody for public comment? Anybody?
We do not have anyone pre-registered. for
Oh
public
my
comment.
gosh, imagine that.
Is there anyone in the
Anybody
room that
Anybody
would
have
like to
thoughts?
make public comment that hasn't signed in on the signage sheet?
Too much turkey this week, too much turkey fan. I don't
Is
know.
there anyone logged in virtually? Okay.
Hand is up.
Somebody's
Representative
name.
Kim Williams is here. Hi, Representative. We're so glad that you're here. We should move you up. Thank you for joining us.
Hi, everyone. This is,
Hi.
hi, Lieutenant Governor. Thank you to the committee for all your work on this. My comment is going to be short. I agree 100% with Representative Bomback's comments, and that's all I have to say, but thank you for your work.
Okay, thank you. Yeah, go ahead.
All right,
Present. And
you restart the timer, go for it.
Tom Bracken, Executive Director of the DSTA, and I just want to get it on the record that in 2011, when we sat down with representatives of the legislature, the governor's office, the administration, and we settled on this 95.5, we did impact our current members. So I think there's a thought process around this table that labor is not willing, that it's automatically gonna be locked in for our membership. When we sat at that table, there was give and take on both sides. And I think both sides walked away feeling like they got the best they were gonna get from each other. And we were more than willing, we did impact our current membership. We took them from 0 to 5 when they retired. So I just want to make sure this committee understands that the rush to change, exactly what you're talking about, the trigger will be when the problem is so bad that we all got to get back around the room like it was in 2011 when the
Oh, I
economic
remember that.
situation was there. Don't think that labor is not going to be a willing participant. So I just want to make sure that that's been put out there.
Anyone else? Other comments?
Anyone at all?
If I might,
Yeah.
no, just.
You wanna make?
Yeah.
You can make it.
Yeah, I know.
Representative
And-
Are you now in the public? Okay.
And I want to make it very clear, along that theme, that we've been very willing to compromise throughout this entire process, as evidenced by the eligibility change. Again, 95-5 split is extremely important to us because it represents an additional cost shift that until the pricing issue is addressed, I'm simply unwilling to support any increase in dollars that would be shifted on the back of retirees or full-time employees. Although they're not part of this discussion, but I would say it's a slippery slope. You change this percentage as it relates to retirees, even though prospective employees. The next issue you're going to have to confront is the split for active employees. So I just put that out there. I'm not sure anyone in the legislature wants to wrestle with that one, but that'll be coming down the road if you tamper with this 95-5.
And David, what comments did you say earlier? Was that kind of, were you coming up with compromise language or no?
No.
Like, huh?
No, I was stating why I disagreed with a lot of things, because there's so much timeline that's happening that to me, it doesn't matter what number we come up with, so I'm
Right.
willing to go with 95.
So you're willing to do that? And is it a base, it's the word baseline? I mean, I'm just trying to think, no.
That may be more Representative Ramon, as far as trigger language about a triggering event for why you would move within the range one way or the other. Is that fair?
That's what I was thinking, but I'm still not willing to do something that unwinds a lot of what we've already done.
Right.
If this is where we go and we start with that, then that's where we go. But I truly am concerned, even after listening to Mr. Bracken, the concern of people being promised something when they're hired and it changing. I know labor came to the table and fought for that to get us to where we need. I was there and I know how that all came down, but I just was hoping we wouldn't be in an environment where we're making a perceived promise that isn't upheld. And I just, that's my main concern of being here today. Understanding, motivating cost controls, I get all that. But I also understand that you worked with your people to get to a point where we're this far. And if this isn't what the sword I want to die on with all this progress we made. So I would be willing to, go with your number and then let's just keep a close eye on it and motivate cost reductions, I guess.
And look, we staked our claim on the whole issue around pricing. Based on everything we've heard over the years, we believe there's money to be saved there. And we're hopefully finally on the cusp of doing something about that. And what we're not willing to do is change the percentages until that work's done. Look, if that work gets done and we don't save any money, then we got to take a step back and we got to reconsider. But I just know if we give on this now, no matter what happens with any of these other things, no one's going to give back, even if there's a statement of intent. The world doesn't work that way, right? So that's where we are is, and Tommy talked about that whole thing back then was a huge undertaking that dealt not only with healthcare was a small part of it. David knows the big savings were pension. And the estimates were the agreements we came up with saved the state $500 million over 10 years. We were willing and we were, I think, strong partners in making changes both in healthcare and pension that made them more sustainable for the state and for our members. I think what we're doing here is a similar step in the right direction, but I'm willing to step, but I'm not willing to jump or leap. And to me, changing from 95.5 right now is taking a leap. Let's get the data, let's get the information, then decide what we need to do and make a decision that's an informed one, not a speculative one, in my opinion.
Go ahead, Wayne.
Who would you see making that decision?
That decision has to be made, so I think there's a couple of bodies, Wayne. Number one, the SEBC deals with the GHIP and its management. If there's a need to do something like that, it's got to go through the General Assembly.
Right.
And look, that's something we always wrestled with at the SEBC. Do we have the ability to say to the General Assembly, you should consider making these changes? What happened back in House Bill 81 in 2011, when that whole structure was brought together and it was worked out, we prepared a package that went to the General Assembly with those recommendations, and they adopted it. I see a similar mechanism here, right?
So,
But what I see is it's one that happens after the work is done to determine what we accomplish by pricing, by subgroup rating, by trying to coordinate benefits, by doing all that other stuff.
okay, so what I hear you saying is you're willing to accept the G&L Medigap, and you're willing to accept 95.5 now with the proviso that it's going to be looked at a later time.
I
And
think
a later
it all- I
time-
think-
and at a later time would be before 1/1/25.
I can't say that, Wayne, because I don't know if the work's gonna be done on this other stuff.
Okay.
What I can
Okay.
say is.
No, I'm not
these-
trying to nail you down, I'm just trying to
These
figure out where you are.
rates and these percentages should always be looked at and always be considered based upon what's going on with the GHIP, with the
Right.
pricing of healthcare, with all that.
Okay.
Like the insurance commissioner was saying, there were many conversations about, do we do premium increases, contribution increases smaller, or do we wait until the funds this has to be managed all the time.
I understand, I'm just trying to figure out what we agree on,
Mhm.
what this group agrees on, and what they want to put off, and I don't have any problem with putting it off. But, so what I hear you saying is, yeah, I'm willing to accept G&L. And I'm willing to, and I want to leave it at 95.5 at the moment, however, that may change in the future.
Yeah.
Everything may change in the future, yeah.
Okay, but, well, I think it's momentous that we're saying to the General Assembly, we want to at some point get off of special medic bill. I think that's pretty momentous.
And
to be
I
able to
said
say
that at the start, I mean, to me, that was the first thing we recognized, we're going from medic bill
Yeah.
Right.
to providing something through the Medigap. And again, just looking at it, just that move reduces cost.
Yes.
Well,
And we think
yeah.
everybody should benefit, and I know, look, it's hard, you can't quantify it, but you can set up some parameters. If we just migrate the population as it currently exists of 30,000 people, based on the numbers today, you're looking at 7 to 26. And I know it's somewhere
I've
in
heard
and
all
all.
these before, Jeff, you don't have to repeat all this, I'm just, you don't have to resell me on it, I'm just trying to nail down what we agree on and what we don't, and I heard it, thank you.
Yeah. So do I have a modified motion that we're gonna move forward with a consensus here to be able to pass all four of these along with the retiree coordination?
Paul, you want me,
benefits?
I'll do it. I'm gonna move the consolidated motion as amended with our conversations throughout to include C as the option for Medicare eligible retirement healthcare benefit changes.
Jeff, you're welcome to do that. You will have a no vote for me if you lead with that one. If you lead with the 5 to 7 and it fails, you'll have a yes on that motion from me.
So we're gonna-
I'll leave it to you.
I made the motion.
Right?
Well, I want to understand, Paul,
Sure.
what you just said.
If we don't have the votes
For
to
the
have the 5 to
range.
7 range, then a follow-up motion at 95.5 will have a yes vote for me. But I won't vote yes for it without trying the 5 to 7 range.
All right, so what I would recommend from here, from my perspective, we do have a motion on the table.
You don't have a second.
We don't
But
have
it
a
hasn't
second.
been seconded.
Hasn't been seconded, but we have now from our co-chair a motion.
No,
We
well,
can have a
No,
motion.
no. I can't make a motion while we're waiting for a second.
Yeah, and if not, unless he lays it on the
It's
table.
not been a second. I'll withdraw that motion for the time being.
Okay, so
Okay.
then we'll turn to you, Mr.
So-
Representative Bombach, for
So
your
I would
motion.
ask the subcommittee members and the public to look at C. And where it is highlighted, I would replace the first highlight with between 5/95% and 7/93%. And I would replace the second highlight with between 5/95% and 0/100%.
Okay. Does everyone follow his proposed change? Okay, now you need a second.
In the spirit of moving it along, I'll
Between
second.
595 and 793.
Okay, and then
Just because
595 and 0.
second doesn't mean I'm gonna vote for
I
it.
think
Second
to
means
be-
I'm gonna put it to
All right.
group for
well, I think
action.
to be consistent, it ought to be 0/100 to 595.
The reason I did it in that order is that not that a legislature in 15 years is gonna pay attention to what I'm saying today. I would like them, if we go towards 7, I want us to go towards 0.
Okay.
That was the intention
Okay,
for that.
so repeat what you
One's
have
coming
there,
up and
please,
one's
so that we
coming
have it
down.
clear on the record.
Because
You
we're
have a
getting more from
second.
G, we can get less from L.
You have a second, and so let's read that for the record. We have a second from Mr. Tashner.
Are there any questions on the motion?
You need to repeat it.
Okay, so the first highlight is that the 5/95 is struck, and I insert the words between 5/95 and 7/93%.
Okay, and this is under option C,
Option C for Medigap G.
so we advise the state change the benefits, okay? So if everyone has that.
And then the last highlight is changed, you strike the 595 and say between 5/95 and 0/100%.
Okay, and so this is the one with the range. It is not the one that you all have in print copy now. So this is an amendment to the original, what's in front of you. So this is the range from 5 to the 7 and the 95 to the 100, okay? So,
Are we voting on the whole thing with that
Go
in
ahead.
it, or are we gonna,
We
are we
can
voting on
discuss
whether
it.
that should be?
I think just this.
just this for now.
I think it's simpler that
Just
way,
this
is that
for
fair?
now. Please do
Fair
it
enough.
just that way, yes.
Yeah,
Thank you.
please from the chair, we're definitely doing it.
We're doing it that way for now,
Would it
because
be
we've got
discussion?
consensus on other, yes, there can
Sorry,
certainly
Madam
be
Chair.
discussion.
Discussion, understanding what I'm listening to, I think there could be ramifications on the ability to be able to pass the ones that we've already spoken about that seem like we're in consensus on or not. There would be, there would be, okay. I just need to get clarity on that.
All right, anyone else? Anyone online? Okay, if not, we'll call the question. I can do it by your preference, sir.
I think we should do roll call.
Okay, we'll roll call. All right, Carol? Ms. Nick?
Did we get a second on that motion?
Yes, you did, Jeff Kashner. Mhm.
I did.
Not that he's committing to vote yes on the motion.
He's just playing so nice in the sandbox. I like it when we're in the sandbox nicely together.
Depends on what's been in the sandbox.
All right,
Or with
Director
your
Kane,
hand. What'd you say?
Director Kate.
Director Cade? Is he still there? We may have to come back to him.
I'm still here. This may surprise you. Yes, go for it.
okay. Secretary DeMatteis,
Not voting.
Commissioner Navarro,
Yes.
Representative Ramon,
Not voting.
Wayne Emsley,
Yes.
David Craig,
No.
Michael Avogado,
No.
Bill Overley.
No.
Denise Allen,
Yes.
Jeff Tashner,
No.
Senator Townsend,
No.
Lieutenant Governor Hall,
No.
and Representative Bombeck.
Yes.
Five yeses, 6 noes, and 2 not voting.
Having failed to receive the required votes for the amendment for the recommendation under option C for retiree coordination of benefits, Medicare eligibility, benefit changes, we will place that on the table as failed and now move to Representative Bombach. I believe you had a
Well,
second.
I think we're going to Jeff.
Jeff,
Yeah,
okay.
I'll move option C as initially drafted.
Second.
Okay, I was gonna see if you
Oh,
had
That
second.
would have been nice in the mirror, but Bill was too fast.
I'll yield to you.
I will second.
Okay.
Not
This is
that I
good. We're all
necessarily
back in the
vote for it.
sandbox nicely. Can we be nice in the sandbox?
Madam Chair,
Okay, yes,
discussion?
yes, you can have a
Yeah,
discussion. Now that, so for Carol's purpose, so she knows it was motioned by Jeff and seconded by Representative Bombach. Back to the original, what's in front of you, option C for Medicare eligible retiree healthcare benefit changes. Yes, go ahead.
Thank you, Madam Chair. Although I very much probably understand and feel comfortable with Representative Bombeck's prior motion, I would strongly suggest we need to come out of this all on the same page. And to be able to get this through the floor, we all have to be united, and I was trying to verify that I believe that effort will be extended, and I think the importance of that effort outside of this room is more important than maybe something being exactly as I perceive it should be today. So having said that, I will be supporting this motion. But thank you.
Okay, thank you. Anyone else online comments? Anyone else here?
Call question.
Okay, we'll call the question on the motion for our eligible voting on Medicare eligible retiree health benefit changes, which was the 25-year retiree at 5.95% plan. Carol,
All right,
turn to you.
Director Kate,
Yes.
Secretary DeMatteis,
Not voting.
Commissioner Navarro,
Yes.
Representative Ramon,
Yes.
Wayne Emsley,
Yes.
David Craig.
Yes.
Jeff Tashner,
Yes.
Michael Pagano,
Yes.
Bill Overley,
Yes.
Denise Allen,
Yes.
Representative Bombeck.
Yes.
Senator Townsend,
Yes.
and Lieutenant Governor Hall.
Yes.
All right. 12 yeses and 1 not voting.
We have consensus, having received the required sufficient number of votes. We hereby declare the passage of option C, Medicare eligible retiree healthcare benefits with the 5 and 95% recommendation. Representative Bombach.
I would like to introduce a consolidated recommendation motion.
Yes, sir.
It is in front of you with the following 4 changes. Healthcare pricing reduction on the next to last line after Medicaid members, adding the words "and collaborating with larger employers of Delaware residents, comma."
Okay. Question.
Well,
Okay, good.
if I
Read them all. Go
continue,
ahead.
under the subgroup rating, on the 4th and 5th line, in each case, removing the 3 words "per covered individual." In the next section, retiree health care premium state share. On the 3rd line, removing the clause beginning with "required to retire" and replacing it with "subject to a mandatory retirement requirement." And on the last line of that section, changing the 95% to 100%. Keep adding things. Under retiree coordination of benefits, adding a sentence at the end. We recognize that this change may result in additional DHR resources. And striking A and B, removing C dash, and leaving the last section Medicare eligible retiree healthcare benefit changes.
Second.
Having been,
Well, stated, rep.
okay,
That was a lot of
Representative
moving
Overly,
parts.
I know has a question on the clause insertion under healthcare price reduction with collaborating players, I believe. Go ahead, sir.
Question, and I apologize, I didn't pick up on it earlier. Why are we restricting it to larger employees? I mean, many small
I
employees.
asked myself the same question. I don't have a great answer on it. I think it's more of the logistics where there's many fewer larger employers and smaller employers. So, we're going to ask every sole proprietorship and as opposed to the impact. So it's a valid question. I think it is valid to take larger out. And keep it more general. It was suggested to me with the word larger, which is why I put it in there. If it's the pleasure of the subcommittee to take that out, I wouldn't object.
I only raised the question, having been married to a former small business owner, that I know wrestling with healthcare issues for a small business person is very difficult, and their input might be valuable, so. Yeah.
I think it's also the case, and perhaps the commissioner can help us with this, where we're trying to avoid the whack-a-mole, where the cost of the private employers goes up. If the larger employers are able to their satisfaction, have wording in any legislation or in any proposed changes that keeps that from happening for larger employer plans, it's also going to apply for smaller employer plans. Is that fair or not
Could you
fair?
Tell me where we are here.
Sorry, healthcare pricing reduction, the next to last line, where we add and collaborating with larger employers of Delaware residents. Are small private plans pitched and filed notably differently from larger private plans?
Yes, they are.
Okay, then I'd say I'm fine striking the word larger from there.
Yeah, because I think you'll
Thank you.
have an issue.
Okay.
Because you want the perspective of that
Mhm.
small business owner.
Representative, may I ask you to reread the entire sentence from beginning to end with it?
Yes, I will. Included in the measures from the General Assembly and the governor should be utilizing the contracting authority of the state, comma, including for state employees and Medicaid members, comma, and collaborating with employers of Delaware residents, comma, to require greater transparency, comma, consistency, comma, affordability, comma, and sustainability.
He's got some other issue going on.
Any other questions?
He's got a lot of issues going on.
Yeah.
She's got a whole book of mine.
Coordination
Sorry.
motion.
Yes.
We didn't really discuss that unless I fell asleep. But, I'm not in favor of that, so I would still vote yes for the whole consolidation, but I just think it's a lot of effort and it's not much bang for the buck, even though we're really going for somebody who's hired at 22 and leaves at 52. I would agree with that, but somebody leaves at 62, most likely they're not going to work something. So not everybody's going to finding other jobs with other insurance. So some of the numbers I've seen of how much savings is I think is way out of
Interesting,
range.
yeah.
But that's just my comment. I will be.
So I'm gonna suggest that if you can come up with a statement that you can email to.
Yeah, let's just.
Just to have it in, no, to have it in the minutes, to have it in on the record.
Okay.
I think that would be it. And I get your point.
Yeah, okay.
So, any other questions, comments from anyone online? So we have before us the consolidated recommendation motion that took a lot of effort with the formal OPEB funding policy, healthcare pricing reduction, subgroup rating, retired healthcare premium share, with the retired coordination of benefits with the item number C. As he indicated, all the other edits have occurred, which meant also Xing out A and B. So, Madam Harold-Mick, will you kindly call roll? Getting myself warmed up for January.
Director Kate,
Director Cade.
He's watching
He's
the Eagles
absent.
highlights.
He's absent.
Just the
No,
overtime.
he's the Washington man.
Oh, well, good. I hope he's watching the Eagles highlights. That's even better.
He's absent.
I will circle back.
Lost in the ether.
Secretary DeMatteis,
Yes.
Commissioner Navarro,
Yes.
Representative Ramon,
Yes.
Wayne Emsley,
Yes.
David Craig,
Yes.
Jeff Cashman.
Yes.
Michael Bogado,
Yes.
Bill Overly.
Yes.
Alan,
Yes, please.
Director Cade, are you there?
Yes, I couldn't get off mute in time to stop you guys. from talking.
He thought you were watching the Washington highlights.
Yeah, I couldn't get off mute in time to stop you guys from talking about Washington.
Secretary, I was hoping you were watching the Eagle highlights. They changed the words.
No, I don't like watching all that cheating going on by the way. But yes.
All right, we'll be back. Procedures, Robert's rules, Masons, we're back to our roll call. Keep going. We're in the middle of a roll call talking about football. Go ahead.
Senator Townsend,
Yes on the motion, no to Director Cade's taste in football team.
Representative Volpeg.
I share Senator Townsend's statement with a
Lieutenant
yes.
Governor, all along.
Yeah, highly Eagles, yes. How's that? All right. So go ahead.
13 yeses.
Well done, having received the consensus of the committee members present, we hereby pass the consolidated motion put forth on formal OPEB funding, healthcare price reduction, subgroup rating, retiree healthcare premium, and retiree coordination of benefits, item C. All right, Kristen, hold on to your seat. You're next, I think, right? Unless there's any other comment from the public, which I don't think there is, we can get to the report. So this will go into the report.
Yes.
So this will go into the report. All right, let's keep rocking and rolling, folks. We are going to our
Can
report.
we state that would go after page 13, the recommendations to the governor and legislature
Absolutely. So these recommendations will go,
at the end of page 13? Is that right? No, page 11.
where would they go? We
Yeah,
should
the
ask
table of
Kristen.
contents
Kristen,
and the
where will it
numbering
go?
doesn't match. You know that. You'll put it in the right place.
Yeah,
Excellent.
Kristen will put it in the right place. Okay. And we did receive, I know Senator Peterson has left today, but she had a good catch. Can you correct Kristen?
Yeah, I already did that.
Can you tell the group though on record?
Yeah, they're on page 10. There was an incorrect date in the request for proposal update section. It said that the contract would awarded from the RFP would be effective January 1st, 2024. That's what it says right now, but it needs to be 2025. Thank you to Senator Peterson who caught that.
You all see that? Does everyone have that? So that date has been changed. That has been the only comments from the public. I'm not looking for a deluge for us. But if you have them, we really out of timing and timeliness from both the subcommittee members, committee members, and the public really need to get this for Kristen and Faith and team so that we can have this wrapped up from our report such that it is ready for the members of the General Assembly and the governor's office when we come together in December. So you really want feedback, right?
If there's any edits, that would be great. I know we sat down with Wayne and.
Yes, Wayne and
worked
I
through a
had an
lot of things,
opportunity.
so.
I have a question.
Yes.
So on the bottom of page 2,
Mhm.
so we have the subcommittee will continue to meet regularly and so forth. Does that mean after the report is done, we're done?
No.
I think if you look at the digital copy, there's some comments that you won't see in the printout, and it basically says there that if this becomes the final report, then that would be taken out.
Right.
So depending on the pleasure of the committee as to whether.
If it does continue, are we going to look at the structure of the committee?
I think those conversations would probably need to happen. I mean, the members of the legislature who created Senate Bill 29 with Senator Townsend present, there have been conversation about the role of the RTAS, how much, if there needed to be any structure change or how often the committee would meet. It could go to quarterly meetings with a subcommittee of members meeting regularly with the pricing issue. I mean, there's form will follow function, and I don't know if, Senator Townsend wants to weigh in. I know Representative Oberly and a couple of folks, kind of perked my thinking in a different avenue, because I had always envisioned, we turn the report in, perhaps we're finished. In reading the code, and having conversations with members in the community, there is a sense of productivity with the committee, but such that we are not meeting 22 times next year like we did in the last 8 months.
As much as we love everyone here.
Yes, Paul, you need other projects. Representative Bamba. Senator Townsend and I will come up with a few for you. But again, if you all, and again, if there's a member here who can't continue to serve or has an issue, you need to let people know that. Because the goal is that there would be some periodic structure that would continue, maybe quarterly to meet.
If I might just throw this out for consideration, Representative Ramon has left. I think there is a comfort level between many members of the General Assembly and this subcommittee. And I think that may come into play if there is a roadblock run into in the future, or decisions to be made regarding healthcare, whether it be for retirees or actives or pre-65. So I think there is a lot of value in keeping, we are constituted and do not.
Well, you are in the code, and that was brought to my attention.
Right. But I think that will serve hopefully as a buffer moving forward and a resource for members of the General Assembly. I think we've proven that we can cut through pretty significant issues and arrive at a consensus, which I think is very important. And I know members of the General Assembly have conveyed to me they appreciate what we've done. So just my thoughts.
Yes, David.
I'd like to comment as a member of the public. And this starts with SEBC. It's always bothered me as a citizen that committee needs a Supreme Court justice to sit on that committee. I think that person should be doing something else. As far as this committee, I think all the elected officials, I've elected you to do other things and not sit on a advisory committee. I mean, you're not really making any decisions, just giving advice. And so we need to structure this a little bit to reflect that. You might want a hand, one or two.
Subcommittee, that's what I said, some key
Yeah,
people.
so we have a lot of firepower on this committee. I think we're doing good things, but I don't think we need that in the future unless it's some emergency or something.
So I just want to be fair that the Chief Justice is on there representing that branch of government whose employees are also subject to the decisions that are made by SEBC. So I don't want to leave that out of the rationale as to why they sit there.
Thank you, Saran, for that. So the Chief Justice, or it used to be his designee, Senator Townsend, I think that was your
Yes, thank you, Lieutenant Governor. I want to echo Director Cade's point. I don't think it was this Chief Justice who was the one who asked that the judiciary be included. But as I understand it, very much so, that branch of government needs to be represented in these decisions and otherwise would not be represented. And I think that when it comes to any concerns about what that means for a judge to be involved in that, I believe there are protocols and processes in place for that judge to then be recused if a conflict were to arise subsequent to that. But I don't think we should be casual or assume that removing the Chief Justice doesn't come with a real loss of a voice for the hardworking employees of a major branch of the state.
Thank you. And I think, Dave, to your point, you've been such a key asset to the state of Delaware in so many committees and work that we definitely, value your input. And I think what you're getting to is, getting in a group where things get done. And I do think we had this conversation because to Faith and to, I mean, everyone here, everyone at DHR, secretary's team has worked really hard. And Kristen, and I think they need a reprieve from our meetings and from us for a bit, but in the meantime, your point's well taken, that, perhaps as the general assembly goes back, if we look at different structures, there needs to be a breakout of a specific subcommittee working separately with whoever where it lands, where we're at the healthcare commission, SEBC, pricing, and we can reconvene as needed. But we will be here in December, don't forget, we gotta come back and vote on this report. And we need the feedback from the report. So don't forget to be here December, what is our date? Because we need the 20th. We really need to know if there's final. Kristen, you want to ask questions now, folks?
I wish.
Go ahead, Representative.
I'm sorry. I had a comment relative to legislative representation on the committee. I think that's critical from my perspective, and I can draw an analogy where members are appointed to the Joint Finance Committee and then come back and inform their respective caucuses of what's transpired and why things have transpired the way they have and the decisions that they've made. So, I believe whatever entity results, or if it's pared down, that there be representation from all four caucuses on this subcommittee.
And when I was talking about DHR being working hard, I didn't mean to slight pension Joanna and others and her team and Margaret, and so many of you have done so much work, on this. It's just been intense, but productive. So I'm not getting opposition to continuance, but we'll meet in December, take a break, see where the structure needs to follow. Kristen, why don't you lead us in conversation with this report? How might we help you? I mean, if we don't have a lot of feedback.
Yeah, I think it would help if everyone could, if you haven't had a chance to read the report, if you could do so like in the next week or two and get any final, obviously we'll add in what happened today, but get any final comments as soon as possible, so that way we could share those before the next meeting, so we could just resolve anything and then it would make it smoother at the next meeting, right? Do you think so, Kate?
Yes, I would agree.
So what date would you like the feed? Let's pick a date and when you need feedback by.
2 weeks from today.
Yeah, like two weeks, I guess, so.
By the 12th?
No, but I'd like to give Kristen some time to be able to put the draft report out a week ahead of time if that's possible, so.
Maybe
You went back up from
Friday
that?
the 8th, Friday the 8th.
At close of business or noon?
Noon, what's that mean? Noon, ask the nurse.
Okay.
We pick noon, because it's always late.
Kristen,
Yeah.
on the request for proposal update that's on page 10, since more has happened since October 24th, can you include the number of submitted bids, which is, part of the information on that website that is listed there, and perhaps the names of them? Because I think that will help. And just for the record, we've had Aetna, Bright Health Plans Solutions doing business as Magna Care out of New York, Aetna out of Hartford, Highmark Delaware out of Wilmington, and Trustmark Health Benefits Incorporated / Luminaire Health Benefits Inc. out of Lancaster, Pennsylvania, as those who sent proposals that were received by the deadline of November 21st at 1 p.m. Does that all sound
That is
accurate?
correct.
Okay.
Finalists will be notified and invited for interviews by mid-December, and we are working to conduct those interviews, I believe, the week of January 8th.
Something else on your report.
Okay. All right, so we have now completed item number 8. We promised to get any changes and feedback to Kristen by December 8th at noon. Item number 9, any additional business that we may have missed, Faith or Joanne or anyone?
I have an idea.
Okay, go ahead, Wayne.
Yes, at the last meeting, I talked about the notion that I felt that that at some point, the legislature and governor needed to put some, to answer the question, are benefits something that somebody walks in the door and has forever? Or is that something that can be changed? And so I've drafted a motion, which I will pass around. Let me grab one. Here, let me pass those one around. I think you have this.
Mr. Emsley, if it is the same version that you sent in email, we can reject that.
Yes, it is the same. I added 2 words, but
Okay.
they don't change.
So for those listening in, Mr. Emsley's handing around a draft motion. Okay, sir, it's up in front of us if you'd like to proceed.
Okay. As I said at the last meeting, we often heard retirees, pensioners indicate that they felt that they were promised their benefits. And I very honestly pondered that myself, whether we really were or weren't. I kept a number of occasions when folks would say that to me, I'd say, well, show me something in writing. And very honestly, I never got anything. I got a few people who handed me pieces of paper that said, these are your benefits the day you retire, but there was nothing in there that said, and you're going to have them for the rest of the days that you're alive. And so I think that that's a key point that only the governor and legislature can answer. And I think they should do that. And so I'm recommending that we include this motion. Perhaps we don't need all the whereas and wherefores, but I think that we ought to ask them to ultimately answer that question. I think it might help them as well.
Mr.
So I have some comments. I don't know
Yes.
if you want to pass the motion second it or just.
I don't know if people want to vote on this now, or if they want to look at it at the next meeting.
Yeah, I would suggest that we consider it at the next meeting, but
So I'd like to hear
wanted
his
present
comments.
it in the
Okay,
public
so we're
session.
presenting it now. Go ahead.
So to me, there's no question. This is not a guaranteed benefit. We had legal discussions back when we created the OPEB trust in the late 90s. Having employees pay contributions, and the answer is no, you can't use it. They pay into the plan, pre-funding it, that becomes a guaranteed benefit. So to me, that's our answer there. Yes, there's a lot of confusion. People think it's a promise, but there's no promises anywhere on your health. Pension is completely different. But to me, it's clear. I know I could lose my health insurance next year. I understand that. Not lose it, but maybe have to pay 100% of the premium. I understand.
And that's exactly what a lot of private sector employers have done.
Exactly.
Right, to have that. All right, well, thank you, Mr. Emsley, for having this. We can come back and confer, and it sounds like perhaps, we have our DAG and others present always too, who can answer such, questions as well. When we meet in December on that topical area, on that topic.
So.
Sorry, the nurse again.
Can I make
topical.
another comment? I'm
Yes.
not going to be here for that
Oh,
meeting.
no.
So to me, this is a very important subject. So I'm not saying don't discuss it or don't vote on it, but
Do you
that's
feel
my
like it's a
feeling.
non-starter with,
That's my feeling. You just heard what I've said. I've said it a couple times. So that's how.
Right. And
Do we work by Masons or by Robert's Rules of Order?
do we? We've been using Roberts.
Okay, so for Roberts, if he's absent, it takes the denominator down. With Masons, it does not.
Right.
So okay, if it was Masons, we'd say your absence is an automatic no vote. But we can't say that. under
No,
Roberts.
we do Robert's rules here.
I move we switch. to
Yeah, you
Masons.
asked that. Yeah, you asked that question at our last meeting. Representative Malbach. That's so great. All right, we shouldn't say the last meeting, next to last meeting of the year.
Can't rush
Okay.
these things.
All right, so any other items, Faith, you were getting ready to give us an update before we agenda. I had to ask if there was any outstanding. I was on item number 9 or discussion, any other business.
Not that I'm aware of from the benefits office and DHR's perspective.
And do we have hands up? I think I saw a hand go up earlier on Zoom, Mr. Swain's hand and Bob Clarkin's hands. I had thought I saw. Yes, I see those. Okay. Comes from Cindy and the Zoom chair in the Senate for too long. I saw hands. All right, so who's there?
It was Dale Swain and now Bob Clark.
Okay, Dale Swain
Did you want to do another public comment round?
here. I don't see anybody wanting to.
No, that's who's.
Yes, I
raising their
think, yeah, we
hand.
should. Yes, their hands are raised. We have time. We should hear from them for sure. We've had no shortage of comment in this meeting. or these meetings.
Mr. Clarkin?
Hi. Clarkin or Swain?
Hello.
Who do you have?
Bob Clarkin.
All right, we'll start. We'll come back to Mr. Swain. All right, Bob?
Hi, can you hear me?
Yes, we can.
I just have a really quick request.
Uh-huh.
Could Kristen possibly include the consolidated recommendation motion that passed with all the new wording in the current draft that's up there now quickly and repost it? So that if we make comments, we're commenting on an updated draft.
Gonna look at her and it depends on the DTI team and the team here at DHR.
I think we would not be able to commit to a redistribution of the draft probably until sometime next week.
Could you?
It would
could-
probably be next week, early next week, and it's due on the 8th.
So are you, I'm sorry, if I may, can you pause this time? Is that possible or not?
Oh, we're not gonna cut this
Okay,
time.
that's fine. Can we offer a commitment that the approved motion is posted by a particular date? If you say a week out, something like that, is that, so that he knows he's got that window from that point until Friday at noon on the 8th or whatever it is, to comment on that? Is that?
I can update the motion. I mean, I don't, it's just more about. Whatever I do, I give to them
Yep.
to deal with, so I don't wanna.
Yeah, I don't wanna,
I don't wanna
commit
promise.
you, so.
She can't speak
So-
for DHR.
Our role
I
in
mean,
this is a little
DTI.
easier, because Kristen is lead on drafting the report, so.
I mean, if you just want me to update your document, I can do that.
Okay,
For next week.
so we can have it up by Friday at noon, which is a week before the deadline for
Mm.
feedback.
I don't know if she could, because she can get it done, but the issue is getting it to DTI to
They're
DHR.
half a day, aren't they?
Well, I wanna make sure I'm understanding, are we suggesting we revise the consolidated motion document and repost that? Or are we
Yes,
suggesting
we
we
post-
incorporate the motions made today into the report?
Oh, that's,
What Mr.
what's
Clarkin was
easier,
asking
what's
was-
easier is probably just to put the consolidated up, right, or no?
Well,
Versus
we've
the
gotta,
report.
put it in the report. I mean, I would be more inclined to suggest we work on adding it to the draft
Okay.
report. So that everyone has access to what
Okay.
the report is for purposes of discussion. When
So
we
to be early
present.
next week, it would be up there.
I think we may be able to commit to Monday to
Okay.
get that.
Oh, that's
Right.
wonderful.
All
right.
Okay, and it will include this, and Wayne's already been working on how he'd like to work with Kristen on where it goes and how it goes.
Okay, so we'll have that. So Mr. Clark, and anything else?
Yeah.
That's fine. Thank you very much.
Okay, thank you. And then where did Mr. Swain go?
Yeah,
Dale?
Mr. Swain.
I'm here.
Yep,
there you go.
Can you hear me?
yes.
We can.
Okay. I just wanted to make a comment in regards to the discussion related to the potential continuing of the committee in some form. I just wanted to state that this committee began because of the very loud voices from both people in the legislature and from the public over how things had gone down last year regarding Medicare Advantage being offered as an option. And this committee has done a phenomenal job. The co-chairs have made sure that public comment was not only heard, but considered. And that's not a common thing sometimes when you're dealing with various organizations. So speaking for myself, and I'm sure most of the other public that's been involved with this from the beginning, we so much appreciate what you guys have done. We thank you for your efforts, and it just has been wonderful.
Thank you, Mr. Swain, for those comments. We have had a hardworking committee and hardworking volunteers and hardworking staff who've looked at a lot of numbers. So thank you, and thank you to those who helped us get to this point, right? And now we get to produce, and hopefully the General Assembly administration has it. So anything else? If not, we are going to.
Another.
Oh, one other hand, go ahead. And this will be our last comment, then we'll go to recess. All right.
Can you guys hear me okay?
We can.
Awesome. My name is Sarah Petrovich. I'm with Delaware Public Media. So full disclosure, I was just, getting info on the meeting. I was wondering, am I able, I know you guys usually cannot address public comment. I was just going to ask a clarifying question on numbers. Is that allowed or can that not be addressed?
You can say what it is, and perhaps offline, one of the staff, if they feel it's appropriate, can discuss with you, or the public relations person can.
Perfect. I was really just curious, like the original numbers that the changes are based on. So I just wanted to make sure that I had the correct, like in the retiree healthcare premium state share, the years of service that were changing, like I had some numbers on that, as well as like the original before the 5.95% split. So maybe if someone just wouldn't mind dropping an email or someone I can direct those to after the call, that'd be awesome. So I don't waste your guys' time.
Yep, so you can send an email to sebc@delaware.com.
Go.
Oh, sorry.
You've been here too long.
Yes, Sarah, this is Faith Runs, Director of Statewide Benefits. So I agree with Carol. If you could send your contact information to sebc@delaware.gov, we'll go ahead and we'll reach out to you, and we can answer the questions that you have.
Perfect. Thank you. I appreciate you guys.
Sure. Okay.
Thank you for being on and covering our meeting and the work of the subcommittee.
Absolutely. Thank you.
All right. Anything else, Carol? Nope. Nope. Okay. Well, good job today, everyone. We've accomplished a lot. We have a motion to adjourn. Do I have a second? Second. Hereby, this subcommittee has adjourned, and we will see each other on December, what was the date? 20th, December the 20th. Here, here.
20th at 10 a.m.
10 a.m.
Location to be determined. We may be in space, so please look for updates on the physical location.
Everybody hear that? We may be in a different location. Did y'all hear that?